Doctor, we talked about the social and cultural changes. What are the medical aspects of this? What are the things in our healthcare system that COVID has exposed for us and has shown us that this is the moment now where we have to fix it? Otherwise, it'll be too late.
So, Kaveri, you're so right. For the first time, I saw people talking about healthcare, the infrastructure, what do we have and what do we don't have, what are the value of a doctor or a healthcare worker for that matter. Recently, over the last few years, doctor became a profession which was being bashed often and more easily. And in fact, the confidence on the medical profession had gone down due to isolated instances, of course, but that gets spread around more it seems that it becomes the norm rather than the exceptions. And that's the perception that patients and public started having. So certainly it brought those issues to the forefront. But what it also showed the various gaps in healthcare. Now, let's first understand that nobody expected that we would need such vast amounts of healthcare infrastructure, equipment, as has been seen in this pandemic. Even the West, which is usually far above in its healthcare spends as well as healthcare infrastructure, could not cope up with the infection, with the COVID-19. So, but it actually drew attention to that. I think that's what the issue is. It did not draw attention to the fact that our healthcare was inadequate, because even the Western healthcare became inadequate. But it drew attention to two or three things. First was, yes, healthcare is important. Healthcare workers do sacrifice their lives for taking care of the patient. And thirdly, we certainly need to have indigenous manufacturing and indigenous production, or the readiness for it, almost like we do in a war, where we should have the readiness and be able to ramp up rapidly if such issues were to arise. And I think those were the very important ones. But as a country, we've been devoid of policies for such things. Now, Atmanirbhar is extremely good, but Atmanirbhar should have been there much earlier than this and should have been there much earlier than this. For that, one needs to really revamp policies in a huge way so as to make it entrepreneur friendly, for them to be friendly to research and innovations, and then for it to be rewarding for research and innovations, to say that we're actually going to have an all-round emphasis on creating a great infrastructure of healthcare.